Hello, my name is Lee Jae-won and I will talk about tooth extraction. Tooth extraction is the removal of teeth from the dental alveolus in the alveolar bone. Extractions are performed for a wide variety of reasons, but most commonly to remove teeth which have become unrestorable through tooth decay, periodontal disease, or dental trauma, especially when they are associated with toothache. Sometimes impacted wisdom teeth cause recurrent infections of the gum and may be removed when other conservative treatments have failed. In orthodontics, if the teeth are crowded, healthy teeth may be extracted to create space so the rest of the teeth can be strained. Before you have a tooth extraction, you have to get a local anesthesia. Dentists to deliver local anesthesia to ensure the tooth and surrounding tissues are numb before they start extraction. There are several techniques to achieve numbness of the tooth, including infiltration, injection containing local anesthetics is delivered into gum near the root tip of the tooth to be extracted. This allows the local anesthetic to penetrate through the bone, eventually reaching the nerve bundle of the tooth to be extracted. You have two types of extraction: simple extractions and surgical extractions. Simple extractions are performed on teeth that are visible in the mouth, usually with the patient with a local anesthetic, and require only the use of instruments to elevate and grasp the visible portion of the tooth. Typically, the tooth is lifted using an elevator and using dental forceps. Specific tooth movements are performed, expanding the tooth socket. Once the periodontal ligament is broken and the supporting alveolar bone has been adequately widened, the tooth can be removed. Typically, when teeth are removed with forceps, slow, steady pressure is applied with controlled force. Molar cut up during surgical extraction. The curvature of the three roots prevented simple extraction. Next one is surgical extractions. Surgical extractions involve the removal of teeth that cannot be easily accessed or removed by a simple extraction. For example, because they have broken the under the gum or because they have not erupted fully, such as an impacted wisdom tooth. So surgical extractions almost always require an incision. In a surgical extraction, the dentist may elevate the soft tissues covering the tooth and bone, and may also remove some of the overlying and surrounding jawbone with a drill, or less commonly an instrument called an osteotome. Frequently, the tooth may be split into multiple pieces to facilitate its removal. Common risks after an extraction include pain, swelling, bleeding, bruising, infection, trismus, and dry socket. There are additional risks associated with the surgical extraction of wisdom teeth in particular. Permanent or temporary damage to inferior alveolar nerve, lingual nerve causing permanent or temporary numbness, tingling, or altered sensation to the lip, chin, tongue. After the tooth extraction, you have some advices. The following can be recommended to encourage healing after tooth extraction. This advice is based on guidance of Flies Cable to the United Kingdom. Avoid exploration of the tooth socket with the tongue, a finger, or toothbrush. Otherwise, this might disturb clot formation. Avoid rinsing mouth for 24 hours to prevent dislodging the blood clot. After 24 hours has passed, use warm salty mouthwashes, especially after meals to keep the wound clean. Avoid alcohol for at least 24 hours. Try to relax for the remainder of the day, avoiding strenuous activities that will cause an increase in blood pressure, as this might disrupt clot formation. For a few days, adapt to diet consisting of soft foods. Thank you for listening.